Let's talk about winning veterans benefits for chronic lower back pain. I've had chronic lower back pain for years. I've also had neck pain for years, and I've also had foot pain for years. So I'm going to try to focus on my lower back, but that's like kind of the problem. Trying to figure out how to focus in on it when it's affecting so many. I'm not saying my back is affecting my neck. They're separate issues. I've had separate MRIs, had surgery on my neck, may or may not need surgery on my back. But it affects other parts, and you may have other things going on. You're miserable, and all you know is, damn, this sucks. I'm in pain. What do I do? Where do I start? So a lot of times I start by going, you know what? Fuck it. I'm not getting out of bed today. I may get a little bed sore or get a crick in my neck, but I'm not going to go hurt myself because I bent down too fast or whatever, grab Clyde and try to give him a biscuit or something like that. So those are what some of my days are like. Um, so in my case, and this is probably with you too, some of your pain is related to your active duty service and some is not. Um, that's my case. My lower back stuff is not service connected, and it's not a result of my active duty service. That's limited to my feet. So, regardless of where you're at with the pain, you need to like start somewhere. Great, well, not great. This sucks. I have pain, and I think it's coming here, and I think it's there, and you do a little googling around and all that kind of stuff. You're not really finding out what the problem is, and especially if you're talking about trying to put together a VA claim for back pain, chronic lower back pain, any kind of back pain claim. You're going to need to go more than, wow, I'm just like in pain all the time. So you're going to need to start off with a diagnosis. It may or may not show up as a specific diagnosis right out of the gate. You may walk in and be like, damn, doc, my back's all jacked up. And then they send you over to an orthopedic guy, surgeon or whatever. And then they might have you jump through some hoops before you actually get an MRI. Get an MRI. When I finally got an MRI, that's when I found out that what was wrong with my neck and what was wrong with my back. In the case of my feet, I just had x-rays, shots, like they were able to tell enough for my feet. But with the back, and which is connected to the neck, obviously, cervical spine, right? Thoracic spine, lumbar spine. So I have problems in cervical and then in lumbar. So you're going to need, some kind of diagnosis. You may not get the diagnosis you're looking for, but you might get enough to go in and get MRIs, CT scans, CAT scans, if they even use those anymore. X-rays, they throw those around like candy. I wouldn't stop at an X-ray. That's not going to show. That's not going to show much. Sorry, I'm seeing stuff popping up on my screen. You that are texting me, everything's getting deleted again. Wait a second. Okay. Um, just a second. I don't know why everybody's getting deleted. Stand by. Damn, this sucks. I don't even know where my Google is. I can't even find my browser. All right. Well, I guess we're just deleted for now. I don't know why. This is why I need help, guys. This would be about right now would be a good time. I can't even get to my browser window to see why things are deleted. So sorry. I guess don't say any bad words. And yeah, there's a lot of filtering going on. So don't say much. So anyway, apologize. So anyway, you're going to need to start off with a MRI, I think. So step one for winning benefits for chronic lower back pain is going to be like MRI, diagnosis. Maybe you're going to actually be able to find out that you have a 10 millimeter herniated disc at L5S1 like I have. So I have a diagnosis of that. Then you're going to need to get that on a DBQ. DBQs are back in play. They never really went anywhere, although they're not on the website yet. And we're going to have to get your doctor to explain how your current back pain problem is connected to your active duty service. This is called the nexus. It's the link. So you need to have all that stuff in order to file a successful chronic lower back pain claim. So let's say that you have all that stuff going for you. You got a rating, maybe 20% for your lower back. You're not feeling like you're fairly compensated because you got this 20% rating and maybe you got some tinnitus or something, so you're like at 30%, but you can't work and you can't do anything. So you need to account for the kind of lifestyle impact your back pain's having on your affecting your social and your occupational impairment. So you're going to need to document that stuff. If you're not talking to with VA doctors, and especially now, you can't even go into a lot of these places. Yeah, I see lots of filtering going on. Sorry, guys. So there's lots of ways you can go about doing this. You're going to need medical evidence to support this stuff. One thing I did last year was cognitive behavioral therapy for chronic pain. So this was a group thing. I'm quite sure they're doing it online now, through, I don't even know what that VA telehealth stuff is. So they're like one-on-one or in a group. So what I was in the group on, and what I found interesting, because we're trying to talk about how pain is showing up in your life and how it's affecting your social life, and you're a worse dad because of your pain, and you can't work period because of your pain. So going into these group sessions, it's interesting listening to other veterans talk about their version of pain and how that shows up. Where I was at, cognitive behavioral therapy for chronic pain. So in this group stuff, you go on there and there's a bunch of people in there, and really the common theme is everybody's just trying to like, hey, I just want to be able to like get my ass out of bed and go tinker in the garage on something, or if it's summer, I want to go be able to tinker around the yard. So it's not like I don't know how many people are in these group things. I think mine was probably like 15, probably. And you all take turns talking and chiming in and stuff like that. And it's medical evidence, by the way, when you're doing this cognitive behavioral therapy. So that's a good way to explain or have medical evidence to support the severity of your symptoms. But what I kind of learned was, or there was a common theme, or multiple common themes. The main one was nobody really knows, right? So you're talking to like the doctor that's running the group, and they're trying to be positive, and like one of my questions is like, so the VA is not into prescribing meds that actually work. What's up with that? Masking the pain. I don't really care about masking the pain. I mean, I want to mask the pain. I don't care if you guys like it or not. It works fine for me. If I mask the pain, then I can move around. So that's one way, one road people were going down. But obviously, that is getting yanked back more and more. So if you're in that mode, you're going to be kind of stuck like me and end up gaining 35 pounds because you can't move around anymore. Some people are talking about breathing exercises. I get it. I have like a little app called Headspace, and I force it to make me breathe. But I mean, great. Okay, great. It worked for a few minutes. Doesn't really do much for me as a lifestyle change. So I don't know what the solution is to chronic pain. Lower back pain. I get epidural shots in my lower back to get rid of the radiculopathy out of my lower back, and I just am careful about what I do. And my story matched up to a guy that's 26, going, "Wow, this is great. This is what I'm doing, and I'm 26, so I have to do this shit for the rest of my life."